Hi there, my name is Kylie Christensen. I am doing remediation for the skill of intramuscular injection. So here we go. First I'm going to start off by verifying the orders and following the 6 rights of medication administration. So that's right patient, right medication, right dose, right time, right route, and right documentation. And after that, I'm going to calculate our drug dosage. So our orders today are morphine, 6 milligram intramuscular injection. The medication I have available is 4 milligrams of morphine per 1 milliliter. So to get our 6 milligrams of morphine, it's going to be 1.5 milliliters for our injection today. So once I've done my dosage calculation, I will gather my supplies and I will head to the room to perform the injection. So once I've reached the patient's room, I'm going to close the curtain for patient privacy. I will perform hand hygiene and begin. Hi, my name is Kylie. I'm going to be your nurse today. Can you verify your name and date of birth? Verifying with 2 patient identifiers since it's medication. Great, thank you. Do you have any allergies to medication, environmental, or food? Perfect, great. So I'm here today to give you a morphine injection into your muscle. That's just for pain, whether it be moderate or severe. That's what morphine is used for. How it works is it's going to kind of confuse your brain and interrupt the messages that are saying you're in pain to help alleviate some of that pain. Just the pathways get disturbed. Some side effects of that might be vomiting, constipation, nausea. Those are normal and hopefully go away with time. Some adverse reactions are going to be dizziness, if your heart rate feels funny, or if your breathing feels labored or challenged. That's something you want to let your doctor or me or another nurse know of immediately so we can address those. Do you have any questions for me? Okay, before we get started, I did just want to let you know that sometimes you might feel some stinging. That should go away after the injection is complete. Okay, all right, so I'm going to go ahead and verify in your computer one more time, and then I'll be right back to get started. So I'm going to go ahead and double check that I have the correct medication, the correct dosage, and then also go over my supplies. But first I'm going to do some hand hygiene and put some gloves on. So for this injection, we are going to be using a 3 milliliter syringe. So I have my 3 milliliter syringe right here. And then I'm going to use a 1-inch 22 gauge needle. So I'm going to go ahead and get that opened. My gloves. Get it assembled. And then I just want to make sure that I have the morphine as prescribed. It's going to be 4 milligrams per 1 milliliter. I'm going to need to do 1.5 milliliters for my injection. So I'm going to begin by withdrawing 1.5 milliliters of air. I'm going to go ahead and clean off the top of the vial. And then I'm going to go ahead and uncap the needle carefully. It's sticky. I'm going to inject the air into the vial. I will turn it over and withdraw 1.5 milliliters. After I've done that, I'm going to tap to get rid of the air bubbles. And I'm going to confirm. So 1.5. Since I need to get the patient prepped, I'm going to carefully recap the needle by scooping it. I will write the medication and the dose and set it to the side to get prepped. Alrighty, after we've done that, we need to select the site of injection. So for this patient, we are going to go ahead and have them lay on their side, and we're going to do the ventrogluteal site. So to identify that, we're going to use the heel of our hand and run it along the greater trochanter, making sure that my wrist is perpendicular to the femur, pointing the thumb up to the groin, and then our injection site's going to be right in the V of our fingers. Before I would do that, I want to go ahead and inspect the site. I'm going to look for redness, tenderness. I'm going to palpate the site to see how that feels. I'm going to make sure an injection hasn't been there recently, just to make sure that that's the appropriate site. So after I've inspected the site, verified the site, I'm going to go ahead and get the site cleaned off. So starting from the inside, working my way out. I'm going to dispose of it. I'm going to let it dry before I administer any medication. So what we're going to do is when we administer it, we're going to use the heel of our hand, not on the injection site, and we're going to kind of create tension and traction to help with that. And we're going to take our 2 fingers, making sure we're not touching where we're going to inject, and kind of pull apart, pulling the skin taut to alleviate some of that pain of the initial stick. We want to make sure we're doing that with our non-dominant hand. So now that it is dry, I will go ahead and take the needle. I will uncap it. With my non-dominant hand, I'm going to pull apart. Intramuscular injections are going to go in at 90 degrees. So I'm going to press in. I can let go of the skin now to support the needle, and I'm going to inject nice and slow. About every 10 seconds, we're going to do a milliliter. After we finish the injection, we want to leave it here for about 10 seconds. We are going to remove the needle, apply gauze, dispose of this in the sharps container. If the patient requests it, we can bandage it. If they don't need it, then we're just going to go ahead and leave it there. Perfect. I will dispose of this. I'm going to remove my gloves, gather my supplies that aren't thrown away, make sure I take the medication when I leave, and I will go document my results.